people of the Eora Nation, the traditional owners of the land I'm on, and pay my respects to elders past, present, and emerging. I would also like to acknowledge Sisters of Charity joining us at this webinar tonight. Their presence links us back to the very beginning of St Vincent's in Sydney. The history of St Vincent spans more than 160 years. It begins when the Sisters of Charity opened a small hospital at Potts Point in 1857. Then in 1870, through a Crown land grant and public fundraising, the Sisters of Charity opened a bigger purpose-built hospital on the current Darlinghurst site, now known as the De Lacy Building. Even then, the sisters were working with government and the community to achieve their vision. That tradition of philanthropy has always brought St Vincent's closer to the community and to its supporters like you. Almost 40 years later, the sisters went on to open St Vincent's private hospital. Since then, our public and private hospitals have worked side by side for more than a century, with a shared heritage and mission of providing the best patient care, but never forgetting the need to care for those most vulnerable in our community. By 1963, the need for a dedicated research institute was identified and came to fruition when the Garvan Institute of Medical Research opened. And by 1996, the Victor Chang Cardiac Research Institute had been established. Also on the Darlinghurst campus, we have the St Vincent's Centre for Applied Medical Research. This has grown from a department in the hospital to now be housed in the lower Packer building. Amongst other things, it leads the rapid translation of emerging cures into improved patient treatments and outcomes through clinical trials. In recent times, we've had other major developments, such as the opening of the Kinghorn Cancer Centre, Australia's first comprehensive cancer centre, and the expansion of St Vincent's Private Hospital with the opening of the Mother Frances McGugan Wing. All of these developments have continued to grow the capacity and impact of the St Vincent's Health Precinct Sydney for the benefit of our patients and the wider community across Australia and indeed the world. In the last 2 years, our hospitals and research institutes have increasingly worked together to protect the health of our community and find cures and treatments for emerging health challenges, such as COVID-19. At the same time, they've stayed true to the St Vincent's values of justice, integrity, excellence, and compassion. This is what we call the St Vincent's Way. So the legacy and values of the Sisters of Charity continue to be the unifying and driving force of our healthcare, research and teaching endeavours across all our institutions. Throughout this time, our achievements have been enabled through the support of government, the private sector, and our own generous family of donors. Your unstinting support of the St Vincent's Curran Foundation, all our hospitals and institutions, has been vital to the development of St Vincent's. I sincerely thank you for your ongoing support and interest in our work. We'll begin tonight's webinar with a short overview video and then be joined by our facilitator, the ABC's Mary Lloyd, to lead the rest of the webinar. I hope you will be as inspired and excited as we are with the vision for the next chapter in the St Vincent's Way.
Since 1857, the St Vincent's Health Precinct has led Australia's reputation and agenda for global health innovation. It's one of few Australian health precincts having impact on the world stage, and yet it's by no means the largest such precinct in Australia. How this impact has been achieved is a story of long-standing legacy, a product of shared values, mature governance, and well-practiced collaboration between its healthcare, research, and teaching precinct partners. St Vincent's Precinct has been the training ground for many of our state's finest clinicians and researchers. Today, the St. Vincent's Precinct has amassed nationally unique technical capabilities in clinical genomics, cardiac care, cell therapies, human immune profiling, cellular genomics, and medical device development, all dramatically improving care for patients across New South Wales, around Australia, and the world. In making such an impact on the world stage, the Precinct partners have never lost sight of their shared mission to serve vulnerable communities. Today, 1 in 4 patients at St. Vincent's Hospital are from vulnerable populations or experiencing addiction, homelessness, or mental illness. St. Vincent's serves all of New South Wales. 10% of patients are from rural and regional areas, rising to around 30% within our centres of excellence. Famed medical research institutes, the Garvan Institute of Medical Research, Victor Chang Cardiac Research Institute, the Kirby Institute, and the St. Vincent Centre for Applied Medical Research operate on the world stage. 3 on-site university partners, Notre Dame Australia, University of New South Wales, and Australian Catholic University educate New South Wales future clinicians and researchers. Being Australia's first health innovation precinct has enabled partnerships to be formed with multiple university partners across Australia and the world. St. Vincent's Health Precinct, Sydney, is New South Wales' original health innovation precinct. Its impact has been woven into the progress of our state and nation since 1857. Right now, we have the opportunity to grow and even transform this proud legacy by investing in the precinct to deliver immediate health, social, and economic benefits for New South Wales and its people. St. Vincent's Health Precinct, Sydney. Pioneering research-driven care together.
Good evening, and thank you, Richard, and thank you everyone for taking the time to join us this evening and for your interest in St. Vincent's ambitious vision. If one thing stands out for me watching that video, it's that St. Vincent's Health is punching way above its weight, both on the global research stage and in terms of the health outcomes it delivers its patients here in Australia. I'm delighted to facilitate the first in this special series of Inside St. Vincent's Vision, taking a look at the plans for the future of St. Vincent's hospitals and their research institute partners. I had the great fortune to spend considerable time on the St. Vincent's Darlinghurst campus just 2 years ago. When we moved into the area here in Darlinghurst, I was thrilled to discover a local bakery, a local bookshop, and little did I realize that I would soon have a local oncologist and a local chemo center as well. Through that time, having access to world-class clinicians who work closely with cutting-edge researchers was an enormous benefit and comfort to me. My first introduction to St. Vincent's was as a patient in the private hospital. And while I was there, it was clear that I would also need the expertise of a clinical oncologist. And one day she appeared there at the door of my room in the private hospital. And we discussed various options for treatment. And then the rest of that conversation happened a few weeks later at the Kinghorn Clinic. And I was several consultations in with her before I actually realized that the Kinghorn Cancer Centre is a public facility. That's how seamless the integration is between the various parts of St. Vincent's campus. And that's how it should be, especially between areas conducting research and those providing treatment. Medical science is advancing at such a pace these days that part of the challenge is getting the latest developments to the patients who need those treatments right now. And that's why it's so exciting to be here today talking about St. Vincent's Health and Research Precinct in Sydney and the plans to ensure the leadership of St. Vincent's can respond to a rapidly changing healthcare sector and immense technological change. I'd like to now introduce Toby Hall. He is the Group CEO of St. Vincent's Health Australia, and he's going to share his thoughts on the future of healthcare.
Thank you so much for that, Mary. It's wonderful to be with you this evening. I don't know about you, but I'm excited about the future for St. Vincent's. I'm excited about the direction we're heading in. And after seeing that video, you can look at what's been achieved today and you could stand and say we should be proud of what's been delivered. But I often think about going back to our foundress, Mary Aikenhead, and saying, what would she say to us today? And she hasn't left us in doubt because she left us many quotes. One of my favorite quotes is this: even when you do your best, you hope to do more, to go beyond. And while St. Vincent's has done some incredible things, and you've seen that in the Precinct video, the question becomes, well, where do we head for the future? What do we need to do now to make tomorrow something we can be as proud of as where we're at today? Our history is quite incredible. We had the first private hospital in Sydney, the first research facilities in Sydney, first palliation services in Sydney. We were the organisation that responded to the AIDS crisis and put the first services in to deliver support to people with AIDS. We're the organisation who delivered the first heart in the box in Australia, which is now a global phenomenon, saving many people's lives. And that's come because of investment from government and philanthropists like you, and we're incredibly grateful for the support. But for tomorrow, we have to do more, we have to go beyond, and we have to deliver new services. And this starts always with research. Our clinical trial research in our cardiac space and our oncology space needs more room to deliver future developments, future change, and actually real translational research which impacts our patients immediately, not after 5 years or 10 years, but actually sees clinicians and researchers working together effectively. And you'll hear about the need for establishment and growth in our research facilities. We already operate outstanding work with Victor Chang, but our oncology and cancer research is now probably the second centre in Australia and has got potential to become first if we can invest in the right facilities to support us. So we need more space for research. As you know, St. Vincent's is the leading cardiac hospital in Australia, and we need to maintain that status. Victoria is currently investing $550 million in a new cardiac centre, which is good for the Victorians. But to maintain our predominant place in this market, we have to have the right facilities. Our cardiac surgeons need more space. We do more heart transplants than anyone else in Australia. That needs space for our cardiac surgeons, but also increased space in our ICU facilities to support those patients as they go through recovery. If we can't have that space and those services, we cannot continue to deliver and extend the research and the impact we have on patients. So that is going to be vital for the future. We also have to challenge ourselves in terms of models of care. And one of the things which is quite clear is that people are spending less time in hospital. We see more and more activity delivered in ambulatory services. That means someone comes to us for under 24 hours and goes back home. And as technology changes and the work that is done with our research facilities allow us to improve the outcomes from a surgical point of view, we have to be able to have fast throughput for patients using different models of care and new technology. What you'll see today is a facility that is promoting for the first time in New South Wales an ambulatory centre which will allow patients to come to us and go home within 24 hours and receive, as far as possible, full treatment, full diagnosis, and to be able to go home to recovery. This project actually identifies nearly $16 billion worth of savings for the New South Wales government that can be reinvested into healthcare. This new model of care is something that, again, St. Vincent's can be the first in. We can lead not just in Sydney, but across the state of New South Wales and actually show other people around the world how healthcare should be delivered. Alongside that fast, rapid response to care will mean we have to be better at providing support to people in their homes. That means technology to talk to them at home, to monitor them at home, to put nurses into their homes. That needs space and it needs infrastructure that has to be delivered. We need that at St Vincent's for the future. There's so many great opportunities in front of us, so much potential. It will only be delivered with the support of philanthropists, government, and our clinical teams being supported by each of us to allow them to do what they do so wonderfully. I'm excited about tomorrow. I think St Vincent's has got a great future. This precinct has been, always will be, the leading precinct in Australia. We're the first to have an integrated campus, and we need to show the rest of Australia how it's done. We're looking forward to your support in that process. Thank you so much, and God bless you all.
Thank you, Toby. It's so exciting to hear all the ways you're thinking of adapting care models there to best look after your patients. Let's introduce the panelists now. We have with us this evening Professor Jason Kovacic. He's the Executive Director of the Victor Chang Cardiac Research Institute, and he started in that role in March 2020. Jason trained as a cardiologist at St Vincent's Hospital, Sydney, and then completed a PhD working with Professor Bob Graham at the Victor Chang Cardiac Research Institute. In parallel with his vital ongoing research to define new ways to prevent and treat vascular disease, Jason is a practicing clinical cardiologist, specializing in vascular disease and blockages of the heart arteries. Also joining us this evening is Associate Professor Anthony Schembri, AM. He is the Chief Executive Officer of St Vincent's Health Network, Sydney. That's a position that he's held since 2014. Over the span of his career, Anthony has been employed in general manager roles at other public hospitals. He holds board appointments across the Sydney Primary Health Network, and he's an adjunct professor in health sciences. Anthony's relationship with St Vincent's predates his role as CEO, as he worked at St Vincent's in varying social work roles earlier in his career. And we also have Hayley Bayliss with us this evening, and she joins as the newly appointed CEO of St Vincent's Private Hospital, Sydney. And she started in that role in February of this year. Heidi was previously the CEO of St Vincent's Mater Hospital, extending her already impressive career in healthcare. She began her career in nursing, and over the years has specialized in intensive care nursing and has extensive hospitals management experience at various other Sydney hospitals spanning some 30 years. Thank you all for joining us this evening, and please make them welcome. Toby, you talked about the changing landscape of healthcare and St Vincent's plans to strengthen infrastructure. Let's start with you talking about the research and the workforce in Sydney. How are you going to meet those challenges to strengthen St Vincent's? Maybe you could give us some insight into some of the strategic projects you're thinking about.
Certainly, the first major project is a development at West Street, where we own some property, where we want to build an integrated research facility to deliver some laboratories to help the research for Victor Chang, a range of facilities to allow research to take place, and some support for our university partners. That is absolutely vital, because we have to have clinicians next to the hospital so we can translate their work into real activity in the hospital. Second thing is expansion of services. We need more space for cardiac services. We need more space for ICU services, and we absolutely need more space to deliver ambulatory care. All of those will need significant investment, and we'll see significant growth at the hospital. Without those, I think it's going to be challenging for us to really meet the demands of the future health system. And so we're putting together a strategy to deliver a research facility to grow the hospital quite significantly. In both cases, we're talking investments of several $100 million. We expect to have support from state governments and hopefully federal governments for those investments, but they are certainly looking for, and I think will be far quicker to move if we have support from philanthropists as well.
Thank you, Toby. I'd like to bring in Heidi now. Could you share with us some of your insight into the changing landscape for private hospitals and their patients? How is private healthcare changing, and why has the collaboration between public and private been so important at the Darlinghurst precinct?
And thank you, Mary. You know, there is certainly a changing landscape at the moment, and certainly private hospitals or private patients have a high expectation. They want to come into a great facility, and they certainly want to be able to access all, you know, the greatest and the latest forms of treatment. And certainly, you know, we are really lucky at the St. Vincent's campus to have a co-located arrangement here where we've got the public and the private, which is owned and operated by the same company, obviously St. Vincent's Health Australia, which enables you know, the public and the private patients you know, to have access to the best available treatment due to that campus. And certainly we're aware that we've got several research institutes on this campus which both public and private can access. Just a few examples of how you know, the public and the private have collaborated over the last sort of 18 months or 2 years over you know, with the COVID pandemic. You know, the private hospital was involved with the cross-campus surge planning. We had private presence and involvement in the public hospital's COVID-19 Emergency Operations Centre during the height of the crisis. You know, when there was pressure on the beds in the public system as a result of COVID, private wards were made available for public medical and surgical patients, and we also had a SCOVID ward, and we made the private staff available to help on these wards due to the capacity in the private or in the public hospitals. Sorry. Now the public mental health, you know, became an issue during the crisis, and we were able to create some space for public mental health patients. We closed our U space, which is the private mental health ward, which enabled the public to utilise that space. We were also able to help with the theatre availability for the public patients, which was fantastic. So there were certainly ways that both the public and the private benefited throughout that COVID period. Clinical trials, Mary, as you are aware, you know, the patients all want access to clinical trials, and clinical trials really need volume. So to have a co-located campus, we were able to generate more volumes with patients. You know, we're able to offer the latest device and clinical trials to private and public patients. You know, is one way of increasing those volumes, which enables us to, you know, show the evidence of better patient outcomes and savings to the health system. You know, private hospital patients at St. Vincent's often have greater access and often the first access to these emerging technologies and treatments through the clinical trials offered across the St. Vincent's Health precinct. And one example is the transcatheter aortic valve implantations, or TAVIs as we call them. A TAVI is a minimally invasive procedure that helps to improve the damaged aortic valve. Now, as we were able to offer this across the campus, the uptake in private patients with the assistance from philanthropy to cover the TAVI costs in the public hospital, the program grew really quickly. And we were able to demonstrate to New South Wales Health the benefits of this program. And as a result, there's now funding available through private health and for Medicare. So both public and private patients are benefiting from this. Our robotics strategy at the private hospital also is an example how both the public and the private can benefit from our robotics. Robotics is certainly expensive, but the patients, you know, they are investigating ways of, you know, providing treatment, and they want the access to robots. Now, we at St. Vincent's Private, we were the first hospital in New South Wales to acquire the Da Vinci robot, and with the cost of the robot covered by philanthropy and other private hospital provisions, we were able to utilize minimally invasive surgical techniques for private patients, but we could also provide that access to the public patients due to our co-location. So, these are examples where, talking about the response to COVID, our TAVI program and our robotic strategy really highlight the benefit of a co-located campus for both public and private patients.
Yeah, thank you, Heidi. I've got to say, as a journalist and working through the period of the COVID pandemic, it was really impressive to see how the St Vincent's Hospital reacted to all of that. And I think, as you say, there having that connection between public and private facilities and the flexibility that allowed you meant that you could make so many more accommodations and were so much more flexible and able to support the public need there, which was, of course, extremely enormous at that time. So that's the link between the public and private. Anthony, I'd like to bring you in back in. You talked about the vision for the centers of excellence, particularly in heart-lung innovation. Can you tell us more about the close link between the areas you're keen to further develop and how this links to patient care through St Vincent's Hospital and the research that's being undertaken at the Victor Chang Cardiac Research Institute?
Thanks so much, Mary. Before I speak to our collaboration with the Victor Chang, I wonder if I might just take a moment to reflect on some of Toby's words. He mentioned it's a very exciting time for our campus with both short-term and longer-term infrastructure developments. And we have a 10-year clinical service strategy that gives us some key focus areas that as a precinct, we want to preferentially invest in and lead in Australia. And one example of those is in virtual care. So prior to COVID, we were the fastest growing virtual care service in New South Wales, delivering care in people's homes, in regions and rural communities, opening up our tertiary level services. Now, one of the things that we're going to need is an expanded virtual care hub for our clinician. So we're doing a lot of planning around infrastructure in this area. Another example is in genomics and precision healthcare, where we are absolutely leading the country in partnership with the Garvan Institute, with the AMR, with the Victor Chang. And so we want a precision healthcare centre that will bring the infrastructure focus to support that work. But of course, one of the things that makes us very special and unique in New South Wales is our commitment to service of the poor and vulnerable, and our particular love and focus for people who might be experiencing addiction, mental health, drug and alcohol problems, homelessness, etc. And so we want to continue to grow and expand these services. And so we have our St Vincent's at Green Park development, where we're working on finalising a new model of care for an urban health centre, which will be a first for New South Wales, a safe haven cafe for people who are experiencing emotional distress. So we have a whole suite of initiatives for the longer term, and we're working with government, we're working with our foundation and our philanthropists and supporters on that. But in the short term, as Toby mentioned, we're currently working on 6 additional new ICU beds that will support our heart-lung transplant program, support our trauma service. We're the trauma centre for the eastern suburbs, but also grow our ambulatory models that Toby mentioned. So we're currently building 12 new heart-lung treatment spaces for our ambulatory patients, which of course leads me to our wonderful relationship with the Victor Chang. We have a Centres of Excellence strategy, which is whereby our services need to meet a minimum standard of clinical outcome and patient experience. And that outcome and that patient experience needs to be best in world. That's the goal that we're setting. And so in neurosciences, in cellular therapies, in infection, immunity, inflammation, and in heart-lung, we reach that goal. The care that we deliver is equal to or better than in worlds. And that's due in many parts to not only the great relationship we have with our research institutes, co-located, collaborating across the campus, across the St. Vincent's Clinic, the private hospital, the public hospital, our university partners and our medical research institutes. And we have a vision that we want that will differentiate us from the rest of the country. And that is that all of our patients have access to trials as therapy. Because one of the things that we know is that if a patient is on a clinical trial, their outcomes are better just by being on a trial. Their access to healthcare, their access to clinicians is greater, and it leads to better clinical outcomes. And so being able to work alongside the Victor Chang, having Jason hold not only his role as the executive director of the Institute, but also as a practicing clinician by the bedside, on call in the middle of the night, coming into care for our patients, we're able to deliver this innovative model of translational research in a way that no other precinct can, and where precincts are now working hard to replicate the St. Vincent's model. So it's an exciting time for us at Vinnie's, and I know Jason will be keen to talk about our new Translational Research and Education Centre.
Thank you. It's just so great to see how St. Vincent's, even though it's now this technological leader in modern medicine and thinking about all these new ways to care for patients, and yet at the same time, it still really honors the vision of its founders, which is just to take such good care of all the people who need it the most. Now, this is a good time to bring in Professor Kovacic. Jason, over the past 25 years, the Victor Chang Cardiac Research Institute has made so many major advances in heart research, many of which have revolutionized our understanding of disease causes, treatment, and prevention. Can you let us know a bit more about that?
Yeah, sure. Thank you so much, Marianne. Thank you for the opportunity to speak a little bit about the Victor Chang Cardiac Research Institute. You're right, the Institute's been going for 25, coming up on 30 years, and there's just been a string of fantastic groundbreaking discoveries made at the Institute over those almost 3 decades of discovery. But there is a couple of standouts amongst all of that, and I have to say, Toby mentioned it already, but one of the great achievements of the Victor Chang Cardiac Research Institute, St. Vincent's and the Precinct, is the advancement with Heart in the Box. So what that is one of the great problems we face around the world is a shortage of cardiac transplant donors. So we do a lot of cardiac transplantation at St. Vincent's. In fact, we're the New South Wales Centre for that. We're actually one of the top few transplant centres in the world, but we do have a great excess of people waiting for transplant compared to the availability of donor organs. So really revolutionary, game-changing work led by Peter McDonald, a cardiologist at the hospital and also full faculty of the Victor Chang, over a series of years led to the development of improved ways for us to transport those vital donor hearts from the unfortunately deceased people back to St. Vincent's for implantation. And over a series of studies done initially here at the Victor Chang and then brought across to the hospital, Peter developed these dramatically improved ways to transfer these donor hearts and then implant them, revive them, and save people's lives. So this has led to the evolution of a whole new way of harvesting donor hearts. It's actually significantly expanded the cardiac donor organ pool, almost doubled that in the space of the last decade. So this is a therapy that it's now taken off in Australia. And we do about 1/3 to half of the cardiac transplants at St. Vincent's by this new method. but it's also so groundbreaking. It's been taken up over the last few years, first in the United Kingdom through the National Health Service there, and also in America. So I spoke to Peter just a week or two ago. The latest figures are that up to 800 people around the world have now had cardiac transplantation through this new method with this heart in the box. That equates to almost 800 lives saved. These people are end-stage heart failure. If they don't receive a donor organ, many of them unfortunately succumb to their cardiac pathology. So 800 lives saved globally in the course of just the last few years. This really truly is one of the great success stories of Australian research, Australian cardiac research, and I think any Australian research. That, not just a research discovery, these are lives saved we're talking about. I think this is profound, and it also really highlights the seamless integration and working backwards and forwards between the research institutes, the hospital, and our patients. And by having that seamless pipeline of discovery and translation and application to our patients, we're able to really deliver the very, very best of care at St Vincent's Hospital and our precinct. There's a couple of other really critical groundbreaking discoveries, and I'll just call one of them out. Many of you will have seen just over the last 6 months this fantastic work, again of Peter McDonald, with this spider venom. So it turns out that a funnel web spider from Queensland has amongst its venom a really fascinating protein which actually has the ability to protect humans against heart attack and stroke. In particular, if you've had a heart attack or stroke and you give this component of the spider venom, it seems to be able to reduce the damage to the heart or to the brain. So Peter is actually going into groundbreaking discoveries now to translate that first through our research studies and then up to the clinic and into our patients. Just before I move off these research discoveries, I would just say that, as I've already said a few times, one of the critical next steps for our precinct is the development of this West Street Translational Research Facility. And one of the key things that Victor Chang needs to deliver in that vision is to increase our ability to do these advanced translational research studies. So one of the key elements to this new building at West Street that we're looking forward to your support on is for the Victor Chang to develop a new facility that will greatly increase our capacity to do this game-changing research, heart in the box, spider venom, and there's just a list of other therapies ready to go for translation and development up to our patients. So I'm privileged to be the director of the Victor Chang, really proud to be a part of this precinct in St Vincent's, and looking forward to the next steps in this journey.
Fantastic, thank you. I need to know more about that that spider venom. That's fantastic. That's a great story.
It is, Mary. It truly is, again, a fantastic story. Happy to share it with you and the people on this webinar.
So before we go to questions from our audience, we've got another video to play that looks into the impact of clinical trials at St Vincent's.
St Vincent's has long made clinical trials part of its standard of care, giving its public, private and aged care patients the opportunity to participate in cutting-edge research trials.
Hallelujah.
The precinct's expertise is in multi-phase and multidisciplinary clinical trials, particularly HIV, viral hepatitis, cancer, neurosciences, gastroenterology, cardiovascular and palliative care. Its clinical centres of excellence have emerged in response to clinical priority areas which in turn are a direct response to community need and State's Office of Health and Medical Research priorities. In recent years, there has been a steady increase in industry-sponsored clinical trials across the precinct, with increased investment by multinational pharmaceuticals and medical device companies. In the future, precinct partners aspire to overlay the clinical trials infrastructure and opportunities across our statewide clinical referral services to expand participation beyond Greater Sydney into regional centres.
Right, we've got some questions now coming in from the audience. The first question we've got here really goes to sort of the nuts and bolts of how some of this works. Someone has asked us, can you tell us how clinical trials work? I'm just wondering who the best person to answer that is. Toby, would you like to field that one for us?
I will absolutely bat that one away to either Anthony or Jason, who are far more capable of answering that well, and possibly Jason would be the best person, if that's okay.
Sure, thanks very much for the question. Clinical trials work through, there are a series of phases we go through. And so when we develop a new therapy, as we've, not just the Victor Chang, the Garvan, there's been many developed on our precinct. The first trials we do in humans are what's called a phase 1 trial, which is a safety trial. So that's usually healthy volunteers. We're just checking that our therapies don't cause untoward effects, then it's safe to administer. We're not really looking to even see if it works. We're just looking to see if it's safe, because obviously safety is always paramount in what we do. Once we've done that in a small number of people, usually 10 to 20, we'll move to phase 2, which is studies which are starting to look at both safety and effectiveness. And once we've moved through phase 2 with maybe 100 to 200 people, we go to phase 3. Phase 3 are the really pivotal trials where they make it or break it. We usually have several hundred people in these trials, and we'll usually, in the most rigorous of trials that we do here, we'll compare what's called a placebo, which is a sugar pill that has no effect, against our therapy or some equivalency. So if it's an IV therapy, we'd have an IV therapy of our active drug versus an infusion of something that was inactive. And by doing these very rigorous studies, we're able to prove that our therapies work very effectively, robust, and can save lives. So that's can take years to go through that pipeline, but due to the integrated research infrastructure and environment we have here, we're able to accelerate that pipeline through these stages of clinical trials and bring these therapies through to our patients quicker than I think any other centre in the country.
Yeah, thank you, Jason. Heidi, I wonder if I could just spin that round to you a bit, and because what we're talking about here is really about how that research then filters through to people who are patients. What is your experience of what you've seen of how that research then directly benefits the patients?
Yeah, thanks, Mary. Well, I suppose the benefit of, the St Vincent's Private Hospital being on this campus, it means that we can offer this, the clinical trials to the private patients. Generally in hospitals, clinical trials are usually run in big public centres. So having the ability to offer that to our private patients and to be able to give them research-driven healthcare is a wonderful offer that we can offer our patients. And because of the co-located campus, we're able to do that. So, and I think, private patients, they're paying their private health insurance. They want access to the latest and the greatest care. And, thankfully at St Vincent's, we're able to offer them that.
Thanks, Heidi. We've got another question here for you, Jason. How does an organisation like the Victor Chang develop its research priorities?
Sure, that's a fantastic question. So we really focus at the Victor Chang on a whole of pipeline approach to cardiovascular disease. So one of our key themes is that we're able to go from really fundamental basic discoveries right up to the clinic. We do tend to focus on diseases that have the greatest impact and diseases where we can make the greatest impact. So we have 5 divisions in the Victor Chang Cardiac Research Institute. We have a vascular division, which focuses on blockages of the arteries that are the cause of heart attack and stroke. We have a heart failure division that focuses on why the pump of the heart doesn't work. We have a clinical translational division. We also have a division around cardiac development to try to understand why babies might have a hole in the heart and things like that. So by strategically choosing these focus areas where we can have the greatest impact and also where there's the greatest need, we believe we're able to structure the Institute in a really rigorous and robust way that can bring the most through to the patients we see.
Yeah, thank you, Jason. This question could really go to any one of you, but maybe Anthony, you could start off by giving us some insight into how your vision is aligned with meeting the needs of an aging population.
Thanks very much for the question. So we're currently doing a lot of work across our colleagues in St Vincent's Care Services to not only integrate our public and private facilities, but also integrate our aged care services. And we have very well-developed clinical pathways from our hospital in the home service, delivering home care to our St Vincent's residential aged care facilities, because of course this is their home as well. We work very closely with a number of our partners in the ageing and disability sector to ensure that our services are delivered in a way that is adapting to the needs of an ageing population. And one example of that is in our HIV program. So thanks to medical advances, people with HIV are living to much older ages. And there's a whole new range of comorbidities and issues that older people with HIV are experiencing. And so we're working with our heart-lung program on a special program around HIV and heart-lung for older people. We know that there are certain cancers, like some perianal cancers, that as people with HIV age, they become more vulnerable for. And we have the state program that is specifically looking at that area. But one of the things that we are working very, very hard at is to ensure that our research programs, our clinical trials, represent the community that we serve, whether that be older people, whether that be opening up trials to people who might otherwise not have access. So for example, people who are homeless. We want fair and equitable advocacy for clinical trials for all people. And older people are one subset, people with mental illness, people who are homeless. We're doing some great work in those areas as well.
Would you be able to just tell us a bit more about those specific areas of research?
Yeah, certainly. So in our cancer program, for example, Jason spoke about early phase work. We're the leading centre in New South Wales for early phase cancer clinical trials. And that's in the area of medical oncology, for example. But one area that is very exciting is in theranostics, which is nuclear medicine. And it is the, previously, nuclear medicine has been used in the medical setting for diagnostic purposes. We are also using it for therapeutic purposes. And so theranostics, therapy and diagnostics. Now, men who are homeless experience prostate cancer in just the same way that men who live in secure accommodation do. And so we've got a program where we're opening up our clinical trials in nuclear medicine for men who are homeless by supporting them through our teeny house, which is a supported accommodation service, if you like, a step up, a step down service for people who have insecure accommodation, who might not otherwise have access to medical care. We can provide a wraparound service, we can provide accommodation, and then we can deliver this advanced theranostic service to men who are homeless, who need the treatment. Now, this is a great example of where our benefactors, our supporters have come together with government funding to be able to deliver not only that wraparound supported accommodation, but also the clinical trials in prostate cancer. So it's one example of where we're able to work with vulnerable people, support them, and make sure they have equal access to clinical trials.
It's a great example as well of how everyone who's working at the hospital just it comes to this with heart and with that genuine care for the community that they're operating in.
Yes.
I think we've got one last question here, and it's a heart question again. This one for Jason. Could you advise what is the technology? What are the technological developments in terms of diagnosis and management of heart-related disease?
Sure, that's a great question. Thank you. So there's just so much going on, and it is quite almost confusing and bewildering because there's so many things out there. And this ranges from, simple devices, an Apple iWatch. In fact, there was a company brought out a ring that you can now wear rather than an iWatch. And this ring, we call it an Hour ring, can monitor heart rate, sleeping patterns, the number of steps you take a day, and measure your cardiovascular fitness and exercise. We do things such as executive health checks where we can look and comprehensively screen people's risk factor profiles. And on occasions, we'll go on to do CT scans of the heart, CT scans of the arteries, looking for people that might have blockages of the arteries or need to address specific things like cholesterol, their weight, their exercise, and so on. We're also getting to the point of genetic testing. So there'll be families that have a history of cardiovascular disease that we may be able to tease out what are the causative genes in those families and which members of those families we need to specifically target on for risk factor modification. So there's so much going on. And we are blessed at St Vincent's with some of the world's finest cardiologists. So I would actually urge anybody who's worried about that or wants to learn more or wants to get a checkup to see one of any of the great cardiologists at St Vincent's is a fantastic way to go forward to organise that health checkup and that heart check. And I would just add, with the tragic passing of Senator Kitching in Melbourne, Shane Warne, Rodney Marsh, last week there was a real focus on cardiovascular risk and premature cardiovascular death, and it really does behoove us all to have that heart check in our sort of 40s or 50s or even earlier to make sure that we're not carrying cardiovascular risk factors and we're doing all we can. St Vincent's is a fantastic place, and our team of cardiologists are fantastic for navigating through that with you and making sure you're in the very best of health and set up for a long and happy life.
Yes, and I know there's also a lot of focus among your cardiologists on bringing more attention to the fact that cardiological issues are not just a male associated disease, that it's actually something very important for women to check up on as well. One very last quick question. How can patients find out about clinical trials at St Vincent's? Jason, I think this is one for you again.
Sure, thank you, and I'd maybe ask Anthony to respond after me. It really depends on what the interest of the specific patient is, whether they're interested in cardiovascular trials, if they've got a heart condition, cancer, so many other things we do, and Anthony's mentioned many of them already. I'd encourage people that are interested, they can reach out to us at the Victor Chang or to the other services at the Garvan, the Kinghorn Cancer Centre. Any of the touch points of the hospital system and the precinct will be more than happy to steer you towards what you may be interested in. I get requests daily from people interested in cardiovascular studies and being both patients and control subjects for the many studies that we run. So I'd urge you to just reach out to the logical touch points and see what's on offer. There's certain to be some clinical trial that's of relevance to almost everybody. Anthony?
Yeah, and just to also reinforce, the point of difference for us is that we are opening up trials as standard of care so that our patients don't need to go looking for trials. As part of the clinical intervention, being offered access to clinical trials is part of the ordinary clinical intervention. But we're also in a process of looking at how we can open up an expression of interest process, I guess you could say, where patients can pre-register their interest in being involved in clinical trials so that we can also proactively engage with patients as important parts of their care journey.
Fantastic. Thank you so much. That's it from me. Thank you to all the panelists for such a fascinating discussion this evening. I'm now going to hand you over to Paul McClintock. He's the chairman of St Vincent's Health Australia.
Thank you, Mary. What a fantastic session that we've all enjoyed. The joy of being on this board is that you think you know what's going on, and then you come to a webinar like this, and I learn as much as everybody else. So that's a real joy of just the complexity of what's going on, but also the wonderful quality. So Mary, thank you for guiding us through this wonderful hour, and particularly thank you for your own story that you started with. I cannot tell you how joyful I feel listening to your story about the seamlessness of your experience on the campus. You couldn't have said anything to me that gave me more pleasure than to hear that story, and I hope it's very typical of the people who come to our campus. I'd like to thank the sisters who joined us. Reference has been made to you, sisters, but we're very much aware of the fact that we are building on your wonderful legacy, but we're also very much aware of your continuing support and your continuing prayers. You tell us many, many times during the year how much this ministry still means to you, and we hugely appreciate that support. I might say, I hope that you listen to this and say, wow, this mob still is trying to do the right thing by what we have done. The incredible combination that we've enjoyed tonight of the science, the hearts in the boxes, and running around catching funnel web spiders and doing all of those things, and yet at the same time, the wonderful stories, particularly from Anthony, but from others, about our commitment to the homeless, to going out and finding the people who were not being vaccinated and chasing them down and making sure they were. The St Vincent story has lost none of its commitment to the poor and the marginalised, while it also pursues this wonderful, and very highly technical science of making a health system better. So I think we've been very much shown tonight that combination, that I think unique combination, actually is still alive and well. Yes, we do have, and Toby mentioned it, but it was also linked, and Jason certainly mentioned West Street. We've got two big projects coming up, which we need support for, government support, obviously our own support, and St Vincent's will undoubtedly support these projects, but the West Street project of translational research is really important for us to complete the research infrastructure. And then, of course, we do need the government to move forward their support for the KLCADA redevelopment of the public hospital. You've heard a bit about why we need that. It is absolutely crucial, and that's why these these next 5 years are going to be really important in locking in the leading role that we've been talking about tonight for the next decades to come. And yes, philanthropy remains a hugely important part of everything we do. Government won't support us unless we can actually come with our own contribution, and it is a real partnership between St Vincent's, the government, and of course the wonderful philanthropic support base that we've got. So on that basis, St Vincent's Curran Foundation, you are a wonderful bunch. You really do provide our link with our philanthropic supporters in a very professional way, a very thoughtful way. You've done a wonderful job tonight putting this together. So thank you again for all the work you do. And perhaps if I could finish, but also thank you for all the presenters and the panel for really taking us through a lot of things in a very short period of time. St Vincent de Paul himself had a quote which I thought was very, very pertinent tonight. It was, "Charity is the cement which binds communities to God and persons to one another." And it did seem to me that I just felt from the people on the webinar, a single join point. We are in this together, and this is worthy work. It's work that I think God would be very happy with, but also a great service to the people of New South Wales. So thank you everybody for being part of tonight.